Hello friends, today I am going to show you the surgical video of Pterygium Excision with conjunctival autologous graft. Pterygium is a triangular fibrovascular growth that extends from conjunctiva towards the cornea. The common risk factors are UV exposure, exposure to irritants, inflammation and chronic dryness. The management include the surgical management is indicated if there is decrease in visual acuity due to astigmatism or encroachment onto the visual axis, or if there is a cosmetically significant pterygium. To start with, we place a superior rectus suture or traction suture to depress the globe with 3/0 nylon. First, separate the conjunctival portion of pterygium from the corneal portion. The corneal portion is gently separated from the cornea. Care must be taken not to enter the Bowman's layer of cornea. The corneal portion of pterygium is excised as much as possible. You may use the blade to excise the remaining portion of pterygium or fibrovascular tissue on the cornea. This corneal portion can be smoothened out with the help of a diamond burr also. It is very important to smoothen out the corneal portion. Blunt dissection is done with the Westcott scissor, and the conjunctiva is separated from tenons. Remove excess tenons under the conjunctiva. While doing this dissection of tenons from the conjunctiva and tenons from the sclera, care must be taken not to damage the medial rectus or rectus extraocular muscle. So this excess conjunctiva and tenons are excised. So after the complete excision of pterygium, the conjunctival, the bare sclera is left, and we measure the conjunctival defect with the help of calipers to mark the area of graft that has to be taken. The conjunctiva, these are calipers. The conjunctival area which has to be excised for graft is measured. I usually inflate the conjunctiva with balanced salt solution or lidocaine. Conjunctiva is separated from the tenons with the help of Westcott scissor. A blunt dissection is done. Try to separate the conjunctiva from the tenons, but take care that conjunctiva should not be too thin, or there should not be any buttonholing while separating the conjunctiva from the tenons. A gentle dissection is done from the tenons under close supervision. Now the conjunctival graft is excised. To place over the scleral defect. Conjunctiva is excised with the help of Westcott scissor, and it is placed over the bare sclera. We use 80 polyglycolic acid suture or vicule suture to fix the graft at two limbal corners. We place two sutures at the limbal corners to fix the graft at its place. This is the first suture. Along with the graft, we take a bite of partial thickness cornea or limbus also. Just a single loop knot is applied. Another limbal suture is applied. I usually avoid cautery in pterygium surgery to achieve hemostasis because the fibrin in the blood itself act as a adhesive. We place another 2 more sutures on the another 2 corners, medial corners. You can also use fibrin glue if it is easily accessible or if it is available to fix the graft. It makes the surgery more easy. So now the graft is placed very firmly. This is the final picture. And we patch the eye for 1 day and with the antibiotic cover. This is 1 week post-operative picture. You can see the sclera is clear, and this is the graft site. Thanks for watching.